presentation will examine Kotter-Grühn and Hess's research on the impact of age stereotypes on self-perceptions of ageing across the adult lifespan. Research has found that self-perceptions of ageing can be influenced by either highlighting the positive or negative aspects of ageing. This can be explained by labelling theory and resilience theory. These theories suggest that individuals can either be negatively affected by the labels used to describe them, or positively affected when they learn to differentiate themselves from the stereotypes presented. This study aimed to investigate the effects of positive and negative age stereotypes on self-perceptions of ageing. The researchers hypothesised that after being primed with negative age stereotypes, older, but not middle-aged or younger adults would report older, felt and perceived ages, and would be less satisfied with their ageing than before the priming. The opposite pattern is expected for positive age stereotype priming. The participants completed a questionnaire to assess characteristics, health and self-perceptions of ageing before commencing the priming task. Using a between-subject design, the participants were randomly assigned to either the negative, positive or neutral stereotype priming. The participants were given descriptions of 5 individuals, and their task was to form an impression of this group. After reading the target descriptions, participants rated each target from 1 to 5 in terms of health, mental fitness, happiness and activity level. The results were assessed in 4 categories: felt, desired and perceived age, and ageing satisfaction. For felt age, younger adults showed no change, middle-aged adults felt older after the priming with positive age stereotypes, and older adults felt older after both the negative and positive stereotype priming. For desired age, all participants reported a younger desired age after being primed with the negative age stereotypes. For perceived age and ageing satisfaction, no significant interaction was found between negative or positive stereotype priming. The researchers therefore concluded that there is some evidence to suggest that self-perceptions of ageing can be manipulated through age stereotypes. However, further research is necessary to confirm this claim. This research is limited in that it can only inform us about age-related differences rather than age-related changes in self-perceptions of ageing, as it is a cross-sectional rather than longitudinal study. Also, in the negative condition, the target descriptions were not exclusively negative. Therefore, the effectiveness of the stereotype activation should be considered, as it may have not been entirely effective. In light of these limitations, this study should be replicated and further research should be conducted. The findings of this study should be considered in fields such as public policy and advertising to better portray older individuals. Integrating positive stereotypes about ageing into aged care facilities may reduce some of the age-typical behaviours, such as slower gait or worse memory performance. This may moderate the negative bias towards old age and could be used to help older individuals accept and understand their self-perceptions of ageing.